Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Good morning, Anita.
Good morning, Dr. Mencia. It's not bright outside
It's not
yet.
bright yet, but we are here, so
Yes.
we bright in the morning.
We are bright in the morning. And I have saved a question for you because everyone says this. If an older person, especially elder person, falls and they break a hip, many of them don't make it past a year. Why is that?
Well, once a person have fallen, for whatever reason, it could be a simple slip and fall. Lots of time I see patients, they go to a restaurant, they don't wear their glasses for whatever reason. They are walking, they don't see the steps in front of them. And they will misstep, and that's a deep fall. If you calculate, a step is about 5 to 7 inches in height. So if you have 3 steps in front of you, talking about some 15 to 21 inches drop. So when a person misstep, instead of stepping forward and thinking that the next step is at the same level they are presently, and it's a 7 or 15 or 21 inch drop, lots of times the hip cannot take it, and the speed with which you're going to hit the ground is going to crash the bone. Especially for those people that have weak bone that don't check their vitamin D, don't take calcium supplement, don't exercise, don't do specifically the weight-bearing exercises. So it's a big force. So when the surgeon have to go in there, it's a big procedure doing the hip replacement. And then after that, the person will become prone, of course, to developing clots. And what is important, there are 2 types of clots. You have the clots, that is when the platelets come together in your blood and form what we call a thrombo, take a accumulation of blood and put it together, and they solidify instead of being liquid. And you also have the fat that comes out of the bone. If you remember when you are eating bone chicken and stuff like that, and you chew on the chicken and you take the bone marrow and you suck on it, that's solid, but it can travel. So when the bone breaks, you can have a fat embolism, and those fat embolism travel all over your body. The worst part to go is your lungs, of course, because it gives you a pulmonary embolism. So a lot of time people will fall and they say, I'm not going to go to the doctor, I'm not going to get checked. And they might not have a significant major break, but they have enough break that they really require surgery. Now, if you do nothing, is that bone going to heal? Yes, it will heal by itself. But you're taking the risk of those things we just mentioned, like developing a clot, a venous clot, or what is even worse, a fat embolism. Because, when it's a clot that comes out of your own blood, we can dissolve it with blood thinner. But the one from fat embolism, sometimes we have to go and put a filter in there to hold it, and it's more of a mechanical, fix than a chemical fix. So,
But Dr. Mencia, I just want to ask you a question. So if someone falls and they come to you, do you have to take an x-ray? How do you know what has happened?
Well, the first is, a good history. Did you fall in a carpet room or a marble floor? Did you misstep? How many steps were in front of you that you missed? A good history, like I always say, what makes me good with my patient is listening to them. And if I listen, my mind is already running, thinking, and I'm coming with a potential diagnosis. So a lot of times, my patient will fall in a cushion area, but they still might have a contusion. So I doubt they will have a fracture. I might not even need an x-ray. But when I examine the patient, I say, you have a contusion, and you might develop a little bit of inflammation. So we're going to treat this locally with creams or patches that will work locally in the area. And then initially, the first 24 hours, we will apply ice to contain the trauma. And after the first 24 hours or 48 hours, then we switch it to heat to bring back the circulation. And, the circulation is what's going to come in and scavenge all of this trauma, take it out of the way and get rid of it. So a lot of time with local management, we can get rid of that. And that is a good question, because if a person has a contusion and you don't treat it properly, it might become a chronic problem. So everything get calcified there, and the patient will say, I have this lump on my right hip that I don't have on the left hip. But they forgot that 5 years ago they have that fall, and nothing was done, and they think it's all gone. And it might not bother you, and it might eventually come back and bother you because you have the fluid-producing area here, and that can become inflamed and can become bothersome. And a lot of time people will go erroneously for hip replacement, and those are the people that go for hip and knee replacement. They say, they replace my hip and my knee, but I'm still having that pain.
Yes, I hear people say that. And what is that caused from?
It's called bursitis. When you get a little bursitis, which the bursa it's like a little bag that brings the nutrients to the joint. So every joint has a bursa. And when that area gets inflamed because of trauma, repetition of movement, when it becomes inflamed, it will produce pain in the joint. But it's not that you're having gout. It's not that you're having arthritis. And when we take an X-ray, we take X-ray on people not because they are having symptoms, and you show it blindly to a surgeon. The surgeon might say, the joints are too close together. This person has arthritis. And then we ask the blind surgeon, can you rate the level of pain this person will be in?
Wait, what do you mean the blind surgeon?
Blind because the person had not really seen the patient. Right. Like that's what we call in research. We call the blind the investigator and then the blind subject. The blind subject can be the patient, they don't know what they're taking, or the doctor, the surgeon, or the clinician. And we ask them, look at the X-ray, and could you tell us what would you do, and what would be the level of pain you would say this patient is at? A lot of time, a person that is in absolutely no pain, they say, that person must be in a level from 1 to 10, he probably an 8 or a 9. The patient is having no pain whatsoever. So the X-ray, like I always said, the numbers doesn't justify the complaint. I usually like to hear my patient. Now, looking forward and being preventive, you can look at an X-ray and say, you are developing a little bit of arthritis. Even though you have no symptoms, you might want to start taking some turmeric and start doing things just to prevent the symptoms from ever coming at you. But you get a lot of people that get really old, and you say, are you having any joint pain? They say, no, I'm okay. Do you get any stiffness? No, I'm fine. And you do an X-ray, and the X-ray might show that it looks like arthritis. But a lot of time we get fooled. I remember one patient that was the mother of a administrator at a 5-star retirement community. So this is the mother now. And the mother was having back pain and was not taking anything for the bones. She was in her 90s, early 90s. And she went to see a back specialist. And the daughter asked, because she worked with a lot of seniors, my mother must have osteoporosis. And he popped the X-ray and he said, look at that. Your mother had the bones of a 20-year-old woman.
Oh, my.
She goes, my God, but she doesn't do anything. She refused to take this. She doesn't like to exercise. She's obese. Say, don't worry, your mother is fine.
Isn't that amazing?
But she's having back pain. So I started going to this facility to see patient. I would go there and see patient. And she said, the administrator said, do you mind seeing my mother? Because she's having this back pain, and she saw the specialist, and they say that she doesn't have osteoporosis. And I look at the X-ray, and I say, oh, my God, She has one of the worst cases of osteoporosis I have seen.
Oh, my.
And she
you
goes
are
like,
kidding.
you are kidding me. That's why I don't trust doctors. That's why my mother doesn't. And she's going crazy. I say,
Oh, I'm
"Well,"
sure.
I say, wait a second. Let's everything, is not what the person said, but how do they explain themselves? You can go back to who you saw, but you have to ask them, how come the bone height in all the vertebrae in the back are so diminished? And what happened to this lady, she has so many fractures in her back that when bone are touching, if you have a loaf of bread and you squeeze it together, of course it look thicker, but it's still the same amount of bread that you have when the loaf of bread was not being squeezed. So I just took a piece of Italian bread and I squeezed it together. I said, that's your mom bone today, and that's what it was supposed to be before.
Oh, boy.
And she understood. She said, that makes perfect sense. So I say, bring me the x-ray of anybody else. Get an x-ray of your back, and let's put it next to your mom so you understand what I'm saying. The height of the back is supposed to be this tall. And then I asked the mother, I said, can I ask you something? You are 91, 92, whatever her age was. When you were 60, were you the same height that you are today? She said, oh, no, I lost like 4 inches. I say, okay, that's your answer. How can you lose 4 inches? Where did they come from? It's not from her leg or her thigh. It's from her back. And then she understood. She said, you know what, Dr. Mencia, I don't need to go to the other doctor. I understand your point. You make so much sense. And I said, she has, severe case. So she doesn't like to take medication. I say, I'm good. You're my kind of patient. You're my kind of girl here. Let's take turmeric. We went to a lot of homeopathic thing and local treatment, working her locally with gels and things that work for arthritis, so she doesn't have to take pills. And she did fine.
Well, I'm not going to let you get off this a minute. All right, so tell all of us what we should be taking, because I've lost inches myself and I don't have any back pain, but I want to know, what do you want me to start taking? I don't want to take supplements. I want to take
we don't
natural.
The good news is that we really don't have to lose height. We don't have to lose height. Okay? We neglect ourselves. That's the bad news. The bad news is we do neglect our back. We neglect our muscle. Now, and that one of the book I want to write about the back. And the way, just like I wrote my kidney book, I tried to make a doctor out of you. So I tell you about the embryology, how the kidney were formed, where the cell came from.
It's a wonderful book.
So the way I want to write this book about the back is because the back is very important because it protects the spinal cord. And the spinal cord is like the center that send the nerves that will influence each and every cell of your body. So it's a very important center. And it houses the spinal cord. Then you have these bones coming together, such a beautiful architecture that God had created when you look at the back. But then those bones cannot be glued together because you need motion with your back. You need to twist left to right, bend down, bend backward. You have to do so many things with your back, so it cannot be glued together. So every time we put a rod in there, we are contradicting God's creation. Of course, it's going to relieve symptoms. It has its indication. Not always. Sometimes we abuse those rods and we overuse them. Because either the doctor is not patient or the patient is not patient enough to say, let me wait and just run the course and see if this will get better in other manner that is not surgery. So if you have no glue, how do we hold them together? You have muscle. You have muscle on both sides, all over. You have muscle like anchor a tower. So you have a tower holding here, but then you anchor the tower with the muscle, and the muscle is what holds that tower in place.
Muscle anchors the tower. That's very well said. So
when you go back home and you look at your couch and say, where is the spot that I sit in my couch? And you're going to have an indentation of your body in that couch in your spot.
Yes.
And Bill going to have an indentation on his spot where he sits all the time. And then you look at that spot and you say, is it symmetrical or is it lean to one side? If it's leaning to one side, it's because you have the habit of, let's say, if your food is on your right, you have the habit and you have your water over here, you're drinking water, you're looking at your computer, of leaning to this side instead of sitting comfortably in the couch straight. Even if it's a recliner, you want to be able to sit straight in a recliner. And then when you get up and you want to exercise your back.
How?
And the way you exercise your back is you start making small torque motion, twisting your back. So you go to your right, taking your right shoulder and bringing your right shoulder back without looking at it so that it come out of your vision. And then you bring it back center. And then you take a deep breath over here. No, don't go the other way. You just take a deep breath right here. And now you bring your left shoulder and bring it back out of your vision.
We're doing this. I wish this were TV.
You bring it back. And then you bring it center. And you take another deep breath. And then you take your neck and you take it to your right, all the way to your right.
I hear it crunching.
Exactly. Good, because you don't do it. These are bones saying, please, why you are not doing this? And then you bring it to the center, take a deep breath, relax, and now you do it to your left. And bring your chin all the way to your left as far as you can without hurting yourself. And then bring it back to the center and take another deep breath.
So that's going to be good, huh?
And then you do it again. You stand up and you take your hip. And you take your right hip, but remember, the shoulder went back. The hip got forward. You take your right hip, you push it forward, and bring it back. Take a deep breath, and let it out. And then take your left hip and push it forward, and bring it back. And that, the spine, you are moving the spine, and then you start doing little twisting motion. Now that was the joint. Now let's work on the muscle part. So you start doing twisting motion with the trunk of your body. So you twist, and the best way to do it, I'm gonna stand up.
Stand up.
The best way to do it, if you're standing straight, you take your right.
Standing.
Come.
I'm standing.
Come with me.
Here we are. We're both standing.
You stand up straight, and you take your right hand, your right arm.
Yep.
And drop your shoulder, sink it down as if you are trying to touch your knee.
Okay.
With the tip of your right finger.
Whoa.
Okay? And then come back, breathe, and then you do your left side and bring the tip of your finger down.
Well, let me tell you something. I can feel that. I mean, that's.
And you know, the spine is so important. You know, it's not like a major organ. It's not your liver. It's not your heart. We worry about the heart. But, you know, if you take care of your spine, do you know you're taking care of your heart? You're taking care of your lung? Because when people are walking and they say, oh, I have a sciatica, that's coming from your back. Or I have a pain on my, what's important, let me tell you, when you go to your podiatrist and the podiatrist say, oh, you're developing calluses, not on both feet, on your right more than your left more than your right. They're coming from your back. So when you mistreat your back, when you start mistreating your back, what's going to happen eventually is going to take a toll on the rest of your body. And that's how we end up getting the heart attack and doing things. And we cannot walk as far as we used to because it becomes a vicious cycle. It becomes that downward spiral we always talk about in medicine, in geriatric medicine. So to avoid that downward spiral, we have to work on that. And another exercise that is important in posture is to take both heels against the wall. You take both heels, and then you take your butt and make sure your butt is touching the wall. And when you do that, all of you are going to notice that your shoulders are not touching the wall. They are leaning forward.
I know.
Okay? So you start bringing the shoulder and the head to touch the wall slowly. You don't have to accomplish everything in one day unless you are a gymnastic or a ballerina. But you can work on it slowly. So you start with a heel touching, and if you have a walker, put a walker in there. If you have a cane, hold a cane in there, and just get your heel and your butt. They're always going to work because there's nothing wrong with your leg, unless you have big trauma or something like that. So the butt and heels always going to work. They're always there. What's not going to work is the rest of your back because we neglect them. So then once you do that, then you start bringing the shoulder and the head slowly back. And what you're going to notice is if you have a 15-degree gap, that 15-degree gap is going to become 10 degrees. It's going to become 8 degrees. It's going to be less and less and less and less until we get to where we want to be.
It's interesting we should be talking about this because I've noticed that I'm starting to hunch over, and I've always had very straight posture, and people are saying to me, what are you hunching over for? And probably the computer hasn't helped, but I've been looking for an exercise to be able to get myself back, put my chest out, put my heel against the baseboard, and then put my buttocks to be there, and then start raising my head.
Your head and your shoulder to put it back.
I know you're very busy, but I was wondering maybe we ought to have a session, invite your patients, or maybe invite, before you had this whole wonderful, we had a tent and we did everything. And maybe we need to do something like this.
I was talking with the administration. I think it was this past week. We're talking with the administration about doing an open house, especially after all the improvement we had done in the office, renovation that we had done. But let's do something like this.
This is to help your back. Everybody, what we went through, I think this is a wonderful thing to do.
And because we have many people that listen to us and they do come to the office, if we do forget when we do the open house, just request it and we will do it.
We're definitely going to do this because I think that we're all facing.
This is crucial. I mean, this will prevent people from dying because,
from falling,
like you say,
first
thing is the fall. The fall will take you in a downward spiral and will kill you. So I think this will be priceless.
It will be priceless, and of course, I have to tell everybody. We're talking about our Cure Symposium in October the 24th. It's a Saturday. You'll just have to do it, and you're just going to leave, but you have to come. Dr. Mencia is going to be one of our distinguished speakers. We haven't figured out what you're going to speak on, but you have so many things that you speak on. But I have to say that this is what you've just done today is so powerful for people. I know they're listening, and they're not realizing what we talked about with the spine and the falling. But I, who feel fine, I don't have any problems that I know of, I've lost inches.
Right.
And I need you to help me. Could I ever get those inches back?
No. You can prevent from losing more.
All right.
Can prevent from losing more.
Then you have to do that for me.
Yeah. And if you work on the muscle, by working on the muscle, I take that back. You might gain a little height back because, when we hump up forward, it makes you shorter.
Right.
But when you go and start working on that muscle and the muscle bring the back to the actual position, the tower that was leaning forward now is straight.
The leaning tower of Pisa.
The leaning tower of Pisa is now straight. And now, of course, it's going to give you a little height. But to gain back when you were 20 years old, no, you're going to, whatever we lose, we lose.
I was 5'8". And now I'm 5'6", and I can't believe that.
And one of the things that I like before we go, how much time we have? We have a few minutes.
Yeah.
One of the things that I like before we go is that we also communicate with the baby boomers. Okay, why is that important? Because a lot of us in our late 30s or mid 40s, they say, "Oh, I'm not 50 or over. I'm not 60 or over. I'm okay. I don't have to worry. That's for old people. I don't have to worry about that." Well, guess what? Bone destruction starts after 30. It's very slow, so we do not miss it. So it's like a millionaire losing a few pennies here and there. Right. They don't miss it, but eventually it can become...
If you had told me, if I had known you 10 years, 20 years ago, I would have prevented maybe losing, so I'm not going to lose anymore. So everybody, Dr. Mencia, he had an extra half hour on the Wonderful World of Wellness. 7 o'clock, we're going to have a special guest. Dr. Arias will be here with Dr. Mencia, so just stay tuned to us. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.